Good evening. I'm Metro Health Director Claude Jacob, and I'm joined this evening by Bexar County Judge Nelson Wolf and University Health's Executive Vice President, Chief Medical Officer, Dr. Brian Alsip. Today, we wanted to share with you that starting this week, we will now have our COVID-19 briefings only on Tuesdays at 6:13 p.m. since our positivity and hospitalization rates have improved. Data will continue to be reported regularly on our website. If you are interested in the most recent numbers, please visit covid19.sanantonio.gov. Before we get into tonight's numbers, I want to share some information about Halloween. With the holiday of the fall season approaching, Metro Health has provided guidance for the public to remain vigilant and to take extra precautions to continue to reduce the spread of COVID-19. Halloween is not canceled, but it is going to look a little different this year again. If you have children who would like to trick-or-treat, here are a few tips to make your outing safer. Most important rule, stay home if you're sick. Wear appropriate face coverings. Costume masks are not adequate protection. Limit the size of your trick-or-treat gathering group to those within your household. Bring hand sanitizer and use it frequently. Avoid going inside homes. Stick to prepackaged treats and avoid shared foods. Wash your hands with soap and water for at least 20 seconds when you return home. If you're handing out treats this year, here are a few ways to celebrate safely. Don't hand out candy if you or someone in your household is sick. Participate in distanced trick-or-treating by not requiring trick-or-treaters to come to your door. When preparing goodie bags, be sure to wash your hands with soap and water for 20 seconds before and after. Celebrate safely this year. For more information, visit covid19.sanantonio.gov/Halloween. Now for our updates. We are continuing to see great progress in our fight against this pandemic. With the case rate down, hospital trends improving, and the positivity rate dropping down to 2.1%, we are in the mild and improving risk level for the third week in a row. Conditions are improving, and as we shared last week, we are in a manageable state of the pandemic. You can help us end this pandemic by getting vaccinated and encouraging others who are eligible to get vaccinated. Let's keep it up, San Antonio. Tonight, we are reporting 261 cases of COVID-19. Our 7-day moving average has gone down to 262 per day. Sadly, there are 2 new deaths to report this evening. Please keep our families and loved ones, keep them in your thoughts and prayers. Regarding our hospital activity, there are 297 patients in area hospitals. There were 25 new admissions, 121 in ICU, and 59 on ventilators. 85% of patients in area hospitals are unvaccinated. We show 11 patients are children. One quick reminder regarding our incentive program. For those of you that have not received your second dose or your 1 dose of Johnson & Johnson COVID-19 vaccine, you are still eligible to receive a $100 HEB gift card if you visit a Metro Health vaccine clinic. This incentive will be available while supplies last. Judge Wolf?
Yeah, well, thank you. Yes, things are certainly going in the right direction. I think since mid-August, we've had about a 100% downward trend in cases. Hospital numbers are going down. I was looking at the number 297 now, and it was 3 months ago that we were at 298. So that's the best we've been now in 3 months. So we're clearly on the right path. You can see also what's happening out at the infusion center where we're doing antibodies, and it's about 30 a day now, where we were running, 130, 150 a day. So clearly that's on the way down too, which is another good trend. University Hospital, Bexar County Hospital, is still doing shots out at Wonderland. George was saying we're doing about 300 still a day, and we're all waiting to see what happens with the FDA approval on vaccines for young people 5 to 11 years old, and the goal is to try to keep this center open till that is approved by the FDA, and speculation or thoughts that it may be the first week of November or by the end of this month, and I hope that's true. I know Dr. Alsip has been working really hard with University Hospital, and he was saying something to me just a minute ago, and I think he needs to say it to the public about, hey, this may be about COVID, but we've got some other viruses that are emerging that could be a problem through the winter.
Yes, that's correct, Judge. We certainly have seen some good trends relative to the COVID cases, as you and Mr. Jacob have shared, moving in the right direction. Well, we've seen that before, twice now with 2 previous surges, so we know that can change. The other concern we have is we are also seeing a lot more non-COVID viruses. We track those routinely amongst the patient population that we see, and we've seen a real surge in rhinovirus and enterovirus that cause illnesses. And, this is similar to what we saw within the past couple of months with RSV, or respiratory syncytial virus. So as we tend to be a little more lax about some of the precautions that we've been using in terms of masking and distancing and hand hygiene, that's one of the reasons those viruses spread. And so we're seeing not only increased frequency of those, we're also seeing a lot more non-COVID business in our emergency departments and in our hospitals that adds to the COVID patients that we still currently have. And unfortunately, a lot of our patients we're seeing have really severe illnesses in many cases because of delayed care over the past 18 months or almost 2 years. And so that's keeping everyone busy and I think very cautious for the future.
Thanks, Dr. Alsip. And thanks, Judge. So to find a testing location or a vaccine clinic, please visit covid19.sanantonio.gov. You can also call the COVID-19 hotline by calling 311 and selecting option 8. Please wear a mask and get vaccinated. Do it for you, do it for your family, do it for San Antonio. Get the latest news and information at covid19.sanantonio.gov. Now we'll take any questions from our reporters.
Judge, could you share your thoughts on giving jail inmates a $100 commissary incentive to get the COVID vaccine?
Quite frankly, I thought it was a very good idea on behalf of the sheriff. The commissary fund is a separate fund that's self-sustaining and in itself derives some profit from some of the meals. So by giving that back to the inmates there, I think we've got about 1,200 of them signed up now to get shots. And so I think it was a great idea on behalf of the sheriff.
To be clear, are you saying that the inmates, the commissary profits pay for the incentive?
Yeah, they do. And the inmates are part of that cost factor. And so it's sort of a give back, I guess you'd say, just like they have to pay for phone calls.
That's all we have tonight. Thank you.